In this video, we will explain why turmeric, despite its reputation as a superfood, can be harmful to certain people. Its healing properties are well known worldwide, but few consider that in some cases it can cause serious harm to health. Scientific research confirms that in certain conditions, consuming this spice is strictly contraindicated. We will discuss who should avoid turmeric and why, as well as explain the mechanisms of its effects on the body. This information is crucial for anyone who cares about their health. So be sure to watch the video until the end to discover the hidden risks this spice may pose. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. The golden spice, understanding turmeric's promise and precautions. Turmeric has captivated both health enthusiasts and scientific researchers across America and beyond, earning its reputation as a golden spice with remarkable potential. This vibrant yellow spice has been deeply integrated into Southeast Asian traditional medicine for thousands of years, standing the test of time as a healing agent. At the heart of turmeric's therapeutic properties lies curcumin, the active compound responsible for its anti-inflammatory and antioxidant effects. Recent research has expanded our understanding of how turmeric benefits various bodily systems, including the cardiovascular system, digestive tract, brain function, and insulin sensitivity regulation. According to research published in 2023 by the American Journal of Clinical Nutrition, consistent turmeric consumption was associated with a 27% reduction in inflammatory markers among study participants with chronic conditions. The Journal of the American College of Cardiology noted in their 2024 review that curcumin supplementation showed promising results in reducing arterial stiffness and improving endothelial function in patients with hypertension. When walking through grocery stores or health food retailers, you'll encounter turmeric in multiple forms, as the distinctive yellow-colored powder in the spice section, or as concentrated extracts, powders, and tinctures in the supplements department. The abundance of turmeric products reflects growing consumer interest in its potential health applications, which range from pain management and depression symptom reduction to its anti-inflammatory, anti-diabetic, and anti-cancer properties. Many consumers face a common dilemma. Should they incorporate turmeric as a culinary spice in their cooking, take supplements, or perhaps do both? Before adding turmeric products to your shopping cart, it's crucial to understand that despite its promising benefits, turmeric may not be suitable for everyone. Important cautions when to avoid turmeric. Despite its numerous health benefits, several groups of people should exercise caution or avoid turmeric altogether. Individuals taking blood-thinning medications should be particularly careful. Turmeric contains natural compounds that can interact with medications such as warfarin or aspirin, potentially amplifying their anticoagulant effects. The American Heart Association's 2023 guidelines on supplement interactions highlight that combining turmeric with blood thinners could increase bleeding risk by up to 30%. Patients using these medications should consult their healthcare provider before incorporating turmeric into their diet to prevent dangerous interactions and complications. People with gallbladder disorders should also be wary of turmeric consumption. The spice contains significant amounts of oxalate, which can stimulate gallbladder contractions and potentially increase gallstone formation. The American Gastroenterological Association documented several cases where patients with existing gallbladder issues experienced acute symptom exacerbation following regular turmeric supplementation. Pregnant and breastfeeding women should approach turmeric with caution. While moderate amounts used in cooking are generally considered safe, the American College of Obstetricians and Gynecologists advises against taking concentrated turmeric supplements during pregnancy and lactation. Research regarding turmeric's safety during these critical periods remains limited, making consultation with a healthcare provider essential before using turmeric supplements. Those with gastrointestinal disorders may find that turmeric exacerbates their symptoms. People with acid reflux, ulcers, or irritable bowel syndrome might experience increased digestive discomfort, abdominal bloating, or diarrhea when consuming high doses of turmeric. The American Digestive Health Foundation recommends that individuals with gastrointestinal conditions start with minimal amounts of turmeric and carefully monitor their symptoms, gradually increasing intake only if well tolerated. Patients scheduled for surgical procedures should discontinue turmeric use. Due to its blood-thinning properties, turmeric may increase bleeding risk during or after surgery. The American Society of Anesthesiologists recommends avoiding turmeric for at least 2 to 3 weeks before any surgical procedure to minimize excessive bleeding complications. Those with iron deficiency anemia should exercise caution with turmeric. A 2023 study published in the American Journal of Hematology found that curcumin can bind to iron in the intestines, potentially reducing its absorption by up to 20%. This interaction could worsen existing iron deficiency or compromise iron supplementation efforts. Individuals with allergies to plants in the Zingiberaceae family should avoid turmeric entirely. This botanical family includes turmeric, ginger, and cardamom. The American Academy of Allergy, Asthma, and Immunology has documented cross-reactivity between these related spices. People with known hypersensitivity or allergic reactions to any of these spices should avoid turmeric products to prevent potentially severe allergic responses. The key to unlocking turmeric's potential. The relationship between turmeric and its absorption in the body can be likened to a key and lock mechanism. Curcumin represents the key, while proper absorption methods serve as the lock. Without the right approach, the beneficial compounds remain inaccessible to our systems. Groundbreaking research at Texas A&M University demonstrated curcumin's remarkable potential in a laboratory setting. When researchers applied turmeric extract directly to human leukemia cells, they observed that these cancer cells stopped proliferating and essentially became dormant. Dr. Michael Thompson, lead researcher on the project, noted, "The anti-cancer properties we observed were striking. Within 24 hours of exposure to curcumin, leukemia cell growth was inhibited by approximately 96%. However, despite turmeric's promising therapeutic potential, a significant challenge exists in making it work effectively within the human body. The primary issue involves curcumin absorption. When we consume turmeric, our liver identifies curcumin as a foreign substance and converts it into a water-soluble form for elimination, resulting in only minimal increases in blood curcumin levels despite substantial consumption. Enhancing absorption, making turmeric work for you. Fortunately, several evidence-based strategies can dramatically improve curcumin bioavailability. Black pepper contains a compound called piperine that inhibits the liver's process of making curcumin water-soluble. Research from the University of Michigan Integrative Medicine Research Center found that consuming just 1/4 teaspoon of black pepper alongside turmeric increased curcumin bioavailability by an astounding 2,000%. Even a minimal amount, approximately 1/20th of a teaspoon of black pepper, can significantly enhance curcumin absorption. Another effective method for improving curcumin absorption involves consuming it with healthy fats. When paired with dietary fats, curcumin can be absorbed directly into the bloodstream through the lymphatic system, partially bypassing the liver's filtering process. The American Nutrition Association recommends combining turmeric with sources of healthy fats, such as olive oil, avocado, or coconut oil, to maximize its therapeutic potential. Many consumers opt for turmeric supplements for convenience, but research suggests this may not be the optimal approach. A comprehensive 6-week clinical trial conducted at University College London in collaboration with the American Institute for Cancer Research examined turmeric's effectiveness on cancer-fighting gene expression. The study involved 100 participants divided into 3 groups. One received a capsule containing approximately 1 teaspoon of turmeric powder, another received a placebo capsule, and the third group incorporated 1 teaspoon of turmeric into their daily meals. The results were illuminating. Participants who took the placebo showed no changes, and surprisingly, those taking the turmeric supplement also demonstrated minimal benefit. However, volunteers who added turmeric directly to their food experienced significant positive changes. By consuming just 1 teaspoon of turmeric powder daily in their meals, they exhibited markedly increased activity in genes associated with cancer prevention. Dr. Jennifer Martinez, an oncologist at Memorial Sloan Kettering Cancer Center, has observed similar patterns in her clinical practice. I had a 62-year-old patient from Chicago with early-stage colorectal cancer who demonstrated remarkable stability in his condition after incorporating turmeric into his daily cooking regimen. Following our nutritional protocol of combining turmeric with black pepper and healthy fats, his inflammatory markers decreased by 34% over 6 months, and we observed no progression of his cancer during that time. Practical applications: maximizing turmeric's benefits. For optimal therapeutic benefit from turmeric, current evidence suggests 3 key principles. First, consume turmeric in its whole root form or as root powder rather than isolated curcumin supplements. The natural complex of compounds present in whole turmeric appears to work synergistically in ways that isolated components cannot replicate. Second, pair turmeric with approximately 1/4 teaspoon of black pepper. The piperine in black pepper dramatically enhances curcumin bioavailability, making even small amounts of turmeric more effective. Third, consume turmeric alongside healthy fat sources such as nuts, seeds, avocados, olive oil, or coconut products. This fat pairing facilitates direct absorption of curcumin into the bloodstream through lymphatic pathways. By following these evidence-based strategies, you can maximize the potential health benefits of this ancient medicinal spice while minimizing the limitations of poor absorption that have historically reduced its effectiveness. When incorporated thoughtfully into your lifestyle, with attention to proper preparation methods and awareness of potential contraindications, turmeric represents one of nature's most promising therapeutic agents, a golden spice whose full potential we are only beginning to understand. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.